Hello. So now we're thinking about the bacterial diseases of the digestive system. And one of the main things that we need to have in mind is in this picture here. So if you look at this picture, you're gonna see that from the production through the distribution, processing of foods, to where they're gonna go, if to a restaurant, if to a retail, and then if it's gonna go to cafeterias and places where people eat together, or home consumers, there is a whole chain of people that we can blame for you having an intestinal disease or some type of gastroenteritis, some type of infection that is caused by bacteria. Okay, so it could happen in any of these steps of the way. Okay, so the whole food production chain is to be blamed for. Okay, we're all involved in this. So let's start by talking about how staphylococcal food poisoning happens. So if you look at this, there's somebody manipulating food, right? So you have stuff in your hands, right? It's part of our microbiome. But sometimes the stuff that we have may be pathogenic to others. So usually what happens is that you allow that stuff to grow on the food by contaminating the food and leaving the food in what we call permissive temperatures. Let me get my pen here. So when you have, this is temperature abuse or permissive temperature. So at these temperatures, it is very possible that the stuff that contaminated that food, if it's a food that is dry, like bread and cheese and full of salt, that's one meats, that's one more beneficial factor for stuff to grow. Because remember, they're halophiles, they don't mind high osmotic pressure, and they will grow at that temperature. So after the bacterium grows, they start to produce toxins. And these toxins that are produced by staph are the ones that are gonna cause what we call food poisoning, because it's an intoxication, toxicosis, okay? And then people may say, well, but I'm gonna leave my food out for 4 hours, 5, after I manipulate it. But it's okay, because later I'm gonna heat my food and then it just kills all the microbes. So what happens is that the bacteria that is growing here in your food will release the toxins, right? And those toxins are not, so they are heat stable. Meaning what? They're not killed by heat. They're not deactivated, denatured by heat. And then when you eat the food, how do you know if what you ate was really causing you a poisoning versus an infection? If you eat and that stuff died, but you still have the toxin in the food, between 1 and 4 hours, you're gonna be in the bathroom. It happens really quick because you're just injecting the toxin ready to cause the damage. So that toxin causes the damage in your intestine, in your stomach, and you're gonna have sudden start of nausea, vomiting, stomach cramps, and diarrhea, okay, in most of the cases. How do you avoid this? If you store the cooked food in wide, shallow containers, at least within 2 hours of the time that the cooking was completed, you're not gonna have issues. So you need containers they're not too big, so the food quickly cools down, and don't leave the food out on a counter for more than 2 hours. Okay, it's the time for it to cool down, and you can put it in the fridge. Then you're not gonna have stuff growing and releasing toxin in your food. Shigellosis. Shigellosis is another disease that can cause abdominal cramps, fever, diarrhea. It may be bloody in this case. It may contain mucus. That's why we call it dysentery. So what is dysentery? It's when you have some type of diarrhea that is associated with presence of blood and mucus in the feces. Okay? So how does Shigella, which is our bacteria that causes the bacillary dysentery or shigellosis, causes disease? The Shigella has that ability to promote your M cells from the, so this is the intestinal wall, intestinal epithelium, right? And then the bacteria manipulates your M cells to project these pseudopods, and then they get actively engulfed. So now bacteria is inside the M cells. With that, they're able to spread to the other epithelial cells, avoiding the immune system, right? They get like kind of like a cab, right? They take the M cell to be able to move to the other cells. Once they destroy that M cell, they start to multiply and they form abscesses. Abscesses are focus of infection where you have a lot of migration of lymphocytes there, but they're not able to resolve the infection, right? Because the cells are dying. So there is a spread, but not to the bloodstream. The bloodstream is really rare. It's usually localized, okay? There are around 14,000 cases per year in the United States. The incubation periods are long, and we're gonna see how with Salmonella is the same thing, between 12 hours and 2 weeks, comparing to intoxication, which is between 1 and 6 hours. It is spread from person to person and can also cause traveler's diarrhea. We're gonna talk about traveler's diarrhea in a minute. The transmission information is here, and these are the symptoms, okay? So whenever you want to remember what happens in shigellosis, you come back to this table. Salmonellosis or Salmonella gastroenteritis. In this case, we have another gram-negative bacterium. This is the Salmonella and the Shigella. I forgot to mention that. They're facultative anaerobe, present in our normal microbiome because they are Enterobacteriaceae, right? There are around more than 2,000 serotypes of Salmonella enterica. So that's why it's really hard to track or make a vaccine or anything like this, because you have multiple serotypes and they suffer mutation. Like I said, incubation period is long. Symptoms: fever, nausea, pain, and cramps, and diarrhea. Salmonella can also spread from animals to people, because usually it's present where? Egg and chicken, okay? So how do you avoid getting contaminated with Salmonella? Clean, separate, don't leave your chicken with your lettuce, right? Put them in separate containers, even more when the chicken is still raw. Cover the container. After cooking thoroughly, all the way through, without any raw part, chill it. This is how you avoid Salmonella, okay? So can you eat running egg? I love running egg, but there is a risk that you can get Salmonella from that because the yolk can have Salmonella. But if you cook the egg thoroughly, then there is no risk, because here we're not talking about a toxin, right? It's the bacterium. So when you heat, you're destroying the bacterium and that's it. So chicken and egg need to be thoroughly cooked, okay? Another way there's an information here. For every person with Salmonella, confirmed case by a laboratory test, there are about 30 more people with Salmonella that are not reported. So it is an underreported disease. Another way of getting Salmonella is other than chicken, egg, other meats like pork, fruits, even processed food like nut butters, frozen pot pies, chicken nuggets, stuffed chicken entries can have salmonella if they're not thoroughly cooked. Also, pets. If you think about those petting zoos, those little petting farms where schools take the children, those little animals can have salmonella. Another way, if you get for your kid those little tiny turtles, it sounds like they're not selling those anymore for this reason. Reptiles have salmonella too. Usually kids put them in the mouth. And then what happens? That little turtle contaminates the kid, and the kid can have an episode of salmonellosis. Okay? The way the salmonella infects the cell is similar for the shigellosis. So here you have the M cell, and the M cell projects the membrane ruffles because the salmonella induces that. And then you have that vacuole with salmonella inside. But in this case, instead of just causing an abscess here like the Shigella, it goes to the lymph nodes, okay? So the fact that the bacteria goes to the lymphatic and blood stream can cause more damage. It can lead to dehydration. And what are the signs of dehydration? When you have prolonged vomit, that's what usually can lead to dehydration. If you make very little urine, if you have a dry mouth and throat, and dizziness when standing up are signs of dehydration. Okay, so keep that in mind. One other thing for salmonella, they also replicate in macrophages. So that's one way that they keep passing from cell to cell. All right. Typhoid fever or typhoid fever. This is caused by a specific serotype of Salmonella enterica that is called typhi, Salmonella enterica typhi. It is only spread by human feces. So there is a story of this lady right here. Her name was Mary, and she was known as Typhoid Mary. She was a cook in New York, and she is believed that she infected 53 people with typhoid fever. 3 of them died, and the first person, and she was the first person identified in the US as an asymptomatic carrier. They tried to remove this lady from kitchens of restaurants, but it looks like she would keep finding jobs and going back, and that's how she contaminated a lot on other people, even though she was healthy. Okay, this bacteria can spread through the body in phagocytes also, and if you have sanitation, if people wash their hands, then you don't have it, right? It's really coming from human feces. So this is different from the Salmonella enterica that is in other animals. Here it's transmitted only from human to human. The symptoms are high fever, headache, intestinal wall ulceration. This fever is usually sustained. It doesn't come and go. It's like a very constant fever of 103 or 104. And other symptoms like weakness, stomach pain, diarrhea or constipation, and loss of appetite. In the United States, it's usually acquired during travel, and people that do not get appropriate treatment for this disease may have fever for weeks or months and may develop complications. Complications of these infections. There are 2 main common complications if typhoid fever is not treated, which are internal bleeding in the digestive system, perforation of the digestive system, usually in the intestine, which spreads the infection to other tissues. So this is the main risk, okay? Typhoid fever regions is common in regions of the world belonging to East and Southeast Asia, Africa, the Caribbean, and Central and South America. It is not common in the United States, and there is a vaccine that can protect individuals for 2 years. So it is a disease that is more dangerous than salmonellosis, even though it's caused by one type of salmonella. And look what happened. In the US, we had a drop of the number of infections in around the years 58, but salmonellosis increased, okay? There is a test called CIDTS, which is Culture Independent Diagnostic Tests, and they are performed in public health labs, and they're very useful as a tool to quickly identify illnesses. So the reason why you started to have more salmonellosis is not that the infection was not there at this point. It was the increase in testing that lead to detection of the close to more real number of cases, okay? So now let's talk about cholera. Cholera is a gram-negative also. It's a rod. It has a flagellum. Vibrio cholerae has his own family, which is Vibrio. That's the genus. And it is associated with salty waters. So if you have environments where the water is not treated, where there's no sanitation, the being around that water and kids putting that water in their mouths and even drinking that water is what's going to lead to cholera. So in places, for example, in places like states of the United States where you have sanitation and there is safety in that sense, whenever there are natural disasters and then sanitation is broken, it's not going to work as well. In these situations, you start to see an increase in the number of cholera cases. One of the signs that you see is these rice water stools, which is very typical. You can lose between 12 and 20 liters of fluid per day, okay? About 1 in 10 people that have cholera will have very serious symptoms. That could include the profuse water diarrhea, the vomiting, thirst, leg cramps, restlessness, or irritability. People with severe cholera can very easily be dehydrated, and that can lead to kidney failure. So if left untreated, which is what's the treatment here? Usually IV fluid replacement. If not, done correctly, that severe dehydration can lead to shock, coma, and death within hours, okay? There is one specific type that is typically infecting health personnel and travelers in area of active cholera that is called Vibrio cholerae 01 and 0139. Okay, so these are the epidemic ones. You don't need to memorize this information, but just so you understand that there are specific strains that cause the traveler diarrhea. So now I have a table just to give you a brief idea of what different E. coli can cause. So there are different strains of E. coli. They all cause gastroenteritis. I want you to remember that E. coli is another one, just like the typhoid fever, that can only be present, I'm gonna write it here, only in human feces. If you find E. coli, there was human feces present, okay? So we have the enterotoxigenic or ETEC, ETEC. These, the enteraggregated and the enteropathogenic, are all present in the small intestine, okay? They cause the ETEC, watery diarrhea, and traveler and infant diarrhea. They produce an enterotoxin that promotes electrolyte loss. So that's why you start to lose so much liquid, because that toxin interfere with your pumps that would absorb water, and then you lose the liquid through the intestine. Enteraggregative is the one that has a very strong tendency to adhere to mucosa and they stop the fluid absorption because of that, and then you have that watery diarrhea. It's very common and persistent in infants. The enteropathogenic is one also that causes a lot of like watery diarrhea, but this one you don't have like any other signs such as blood in the feces or mucus or vomiting. Again, adherence and destruction of epithelial cells. Okay, so they damage the intestinal wall by how strong they attach to it, and that, you know, leads to deregulation in water absorption. And then you have the ones that are more, let's say, serious because they affect the large intestine. What's going on with large intestine? That's where we have most of our microbiome. And also large intestines where you have most of your water absorption. What is water absorption? Water going from the lumen of your intestine back to your body. Because when you drink water, water goes all the way down to help push your foods down, the bolus, to the intestine. But when it gets there, most of the water is absorbed back to the body and then is filtrated through the kidneys, right? The water that is not being able to be absorbed is going to cause watery diarrhea. So in the case of large intestine, when dysfunction is committed, that's when you're going to have most of the issues, because you're going to have severe dehydration, but also the enteroinvasive and the enterohemorrhagic E. coli are going to cause dysentery, because they really harm very badly the intestinal wall, and you have bloody stools. Another consequence that is mostly seen in the enterohemorrhagic, which is the most serious one, is hemolytic uremic syndrome, which is because of that blood loss, you decrease the number of RBCs in the body, and that, because the water is not being reabsorbed, you can have acute kidney failure. You don't have enough water to dilute your blood and your urine. And that, because of the blood loss, you can also have low platelets. So that is related to this hemolytic uremic syndrome, and is associated with an E. coli that is called O157H7. What is this? Remember that the O is an antigen so O is present mostly in gram-negative bacteria. It's present, it's part of their LPS. And then the H here stands for flagellar antigen. So these antigens are very common to mutate. So that's why you have different strengths, because remember, surface antigens usually mutate, and then new strains that are being formed are going to be probably ways to evade the immune system and cause more harm. Okay? So when we talk about traveler's diarrhea, it is all types of infections, intestinal infections, that can happen when you travel somewhere else and you're in touch with microbes that you're not used to, that your immune system is not used to recognizing. So most of these traveler diarrhea cases are caused by Salmonella, Shigella, and Campylobacter, but can also be caused by Giardia. The difference is that protozoa diarrhea is usually milder, and it lasts a shorter time. Bacterial diarrhea usually lasts 3 to 7 days. Viral diarrhea usually lasts 2 to 3 days. So the bacterial one are longer periods. Okay. And you only have to really do oral rehydration therapy and bismuth containing preparation, which are antidiarrheal medications. Another thing that helps here is to withdraw lactose, because once you lose the E. coli from your intestine because of that massive diarrhea, you start to lose the microbiome E. coli that we have. We are unable to ferment lactose. And that increasing lactose in your intestine makes it more irritable, and then you're gonna have more diarrhea because of that lactose. Helicobacter peptic ulcer disease. So now we're gonna talk about a disease that happens in the stomach, and it's caused by Helicobacter pylori. That's the name of the bacterium. So when we have this type of infection, it is very dangerous because it can lead to stomach cancer. Okay, so that's a big risk, because the way the bacterium damages the stomach mucosa causes an inflammation, and that can modify and mutate cells. 90% of duodenal ulcers and 80% of gastric ulcers contain H. pylori. Okay, so it's very related to see ulcers, with the presence of this bacteria. So one of the things that make this bacteria survive in the stomach acid is the production of urease. So this is what happens. This is the stomach wall, right? And then you have, this is the mucous layer that protects your epithelium. The urea that is present in meat, right? When we eat meat, and meat, so I'm gonna write here, meat is broken down into urea. Urea, by the presence of urease, is transformed into ammonia. Ammonia is broken down into ammonium. The way that the ammonia present here neutralizes the acid is that there is another reaction here. The ammonia that is present by breaking down urea with the bacterial urease, when it's combined with the gastric acid or hydrochloric acid, produces ammonium chloride. This is ammonium chloride. Remember, the hydrochloric acid is being produced by the glands that we have in the stomach wall. Okay, so with that, you neutralize that acid, and then the bacterium is able to survive in this environment. It's not that they like the acid, it's that they break down the acid, they neutralize it, and then they can survive. Okay. There is a way, so then you have destruction of this tissue, you see, because you're destroying the mucous layer and the epithelial cells. There's a way to test if somebody has this bacterium. The urea breath test is a test where you give to the patient radioactive urea, and that in the presence of urease that is specifically produced by H. pylori, and nobody else that would survive in the stomach would produce urease. So then that's the indication that you or the patient is infected with H. pylori. The urease will transform urea into ammonia and CO2, carbon dioxide. So the CO2 uses the carbon from the urea molecule, so it's also radioactive. So the person exhales that CO2 that you can detect with what's called a breath card, which is this. And then you can say if the person has radioactive CO2, that means the person was infected with H. pylori. Okay. Another type of infection that happens in the stomach and intestine is Clostridium perfringens, the same bacterium that causes gas gangrene. And it is associated with a toxin, an exotoxin that is produced in foods, usually that contain animal organs, like intestinal organs, meat, poultry, and food in large batches. Like people that eat in foods that are served in big cafeterias, such as in hospital, schools, prisons, nursing homes, catered food, all these food that are in large batches have a tendency of containing Clostridium perfringens if not care for the safety temperature, which would be keeping the food at fridge temperature after 2 hours of cooking when it's cooling down. Keeping food in shallow containers so it can cool down quickly. And you can also have outbreaks during Christmas and holidays because people are eating food in large batches and that kind of stuff. Usually symptoms happen after 8 to 12 hours from the ingestion, which shows when something is related to an intoxication, right? It happens quick. Another Clostridium that is also endospore forming is the Clostridium difficile. This Clostridium has a tendency, once you get infected with it, to be part of your microbiome, and then it doesn't grow much unless you take extended periods of antimicrobial drugs that will kill your microbiome, and C. diff, that's how it's called, like the nickname, would grow. Okay? So you have to tell your doctor if you have C. diff, if you had C. diff before, because one of the ways to treat this is by using fecal transplant. You take little pills of poop, and that will help to replenish your intestinal microbiota in a way that C. diff would not overgrow. Another way to avoid it is washing the hands. Okay. Why is this life-threatening? Because it causes a colitis, which is ulceration and perforation of the intestinal wall. Symptoms here are severe diarrhea, fever, stomach pain, loss of appetite, and nausea. Okay? If people that are 65 or older have a bigger tendency of getting this disease. People with weakened immune systems, such as AIDS patients, cancer, or organ transplant patients that are taking immunosuppressive drugs have a bigger tendency to have this type of dysentery, okay, or diarrhea, sorry. Bacillus cereus causes a gastroenteritis also, so it can commit stomach and intestine, and this disease is usually of two flavors. There are two different diseases that can be caused by Bacillus cereus. One is more like an abdominal pain and non-bloody diarrhea, and incubation period is quick. Another one happens also quick, between 1 to 5 hours, even quicker, and usually is characterized by nausea and vomiting. Okay. Diarrhea is not common in this case. It's more that in discomfort in the digestive tract. And you have around 64,000 cases per year in the United States. Foods that can be contaminated with Bacillus cereus include rice, that's why I put a picture of rice here, but also soups and vegetables and meats and vanilla sauce, raw vegetable sprouts, if stored in non-appropriated conditions. For example, you wait too long to put it in the fridge, and then you can have production of toxins that will intoxicate the patients. That's why these symptoms in this disease are quicker, because it's an intoxication. Okay? Okay guys, next video we'll talk about viral diseases and then helminthic diseases.